Hi, I'm Megan. I'm a pelvic floor physiotherapist, and I'm going to be talking about perineal massage. So this is a technique that people can use during pregnancy. We usually recommend people start it at about 35 weeks and continue it through the rest of their pregnancy. And the goal is to help potentially prevent or reduce tearing during the second stage or the pushing phase of childbirth. So people sometimes have fears around tearing, and this can be, and evidence has shown in some cases, that it can reduce tearing or reduce the use of episiotomies. So I'm going to explain that all a little bit more. First by saying, what is the perineum and what have we been talking about? So I'm going to show this anatomy here. So this part of the pelvis is the front, and this part of the pelvis is the back near the tailbone. And in here we have three holes. Up here we have a hole inside this hole called the urethra that we pee out of. And then we have the whole vaginal opening, and then we have the anus opening. And the perineum is the tissue between the vaginal opening, the vaginal hole, and the anus hole. So that perineum tissue there is why we call this perineal massage. And if there is tearing during pushing, it's usually that as this hole, the vaginal opening, is getting bigger to let the baby come out, that there can be some tearing at the perineum. So we can do perineal massage. So how do we do that? So I'm going to use a couple different stages, and different people are going to come at this different parts of their comfort level. So for some folks, the first goal is just to look at your own body. So you maybe get a mirror, look at the skin of the vulva, try and get to know, where is the urethra that I pee out of? Where is the vaginal hole that this baby's going to come out of? Can I touch that perineal tissue between the vagina and the anus? Maybe I can apply a little bit of pressure to the skin on the outside of that area and get comfortable with that. And as I'm doing all that, what's happening in my body? Am I noticing some tension? Am I able to stay calm and soft and breathe through that? What kinds of sensations are happening? And that mind-body connection helps us mentally prepare, as well as the stretching that we're doing might help us physically prepare. So those two things, in my opinion, go really well together. So the actual then perineal massage, if you're comfortable, you can insert a finger into the vaginal space, and we're going to go maybe only this far to that first joint of our finger, or maybe as far as the second joint. There's no real right or wrong, but you're not going very deep into the vaginal area. So I'm going to show this as though this is an enlarged vaginal hole, and where I've drawn some arrows is the tissue of the perineum. So if I insert a finger and apply some pressure, I want to imagine that vaginal hole getting bigger. So I can pull the tissue down in the direction of 4 o'clock, 5 o'clock, 6 o'clock, 7 o'clock, 8 o'clock. So for 4 o'clock, I'd go into that first joint of my finger, I'd pull down and out to create an opening stretch, and I want to feel a slightly uncomfortable stretch, and just be with that, and just breathe, notice how you're doing, and spend some time with that. And then pause, take a break, do whatever kind of helps you reset, and then repeat at 5 o'clock, going in this direction. Sit with that, breathe with that, be with that. And then repeat straight down for 6 o'clock, and off to one side for 7 o'clock and 8 o'clock. So that's the concept of one way of doing perineal massage. There are other ways described out there where you might swoop through the tissue or go back and forth. That's fine too if that works for you, but in my practice I have found that that sustained hold and sitting with that and breathing with that and being with that can be really helpful for people to mentally prepare and physically prepare for that stretch during the second stage. If you have any questions, then I'll check with your physiotherapist or shoot me a note.